To begin with, I must thank Prasanna for such a interesting and an excellent session on nudity. And I'll be talking about management of women's sexual dysfunction. पण मला वाटतं की आता पुढे जायच्या ऐवजी आज मराठी भाषा गौरव दिवस आहे आणि वाईहून म्हणजे कृष्णा तटावरून मी गोदातटी असणाऱ्या नाशिकच्या कुसुमाग्रजांच्या गावी असणाऱ्या मंडळींशी बोलतोय. त्यामुळे इथून पुढे मला जे काय बोलायचंय ते बोलण्यासाठी मला वाटतं इंग्रजीचा आधार घेण्याऐवजी मी मराठीतच बोलतो, म्हणजे आजच्या दिवसाच्या औचित्याला ते धरून होईल. माझी स्क्रीन बदलत नाहीये इथे, एकच मिनिट. I'll stop share and start again.
सर नेक्स्ट स्लाइडला क्लिक करून बघा एकदा.
नाही होते स्लाइड क्लिक करून, माझ्या कॉम्प्युटरवर पण नाही बदलत आहे. आय जस्ट चेक. ओके, तुम्हाला दिसले का दुसरी स्लाइड?
हो सर, दिसते आहे. ओके सर,
ठीक आहे. सर्वप्रथम मराठी भाषा गौरव दिनाच्या सगळ्यांना शुभेच्छा देतो आणि मी सुरू करतो. एकूणच लैंगिकता आणि लैंगिक प्रश्नांबद्दल बघण्याचा आपल्या समाजाचा आणि त्याच्यामध्ये डॉक्टर सुद्धा आले यांचा दृष्टिकोन काही फारसा उत्साहवर्धक नाहीये. त्यामुळे साधारणपणे पुढच्या 45 मिनिटांमध्ये स्त्रियांच्या बाबतीत त्यामध्ये नेमके कुठले प्रश्न निर्माण होतात आणि ते का निर्माण होतात आणि त्यांची सोडवणूक कशी करायची याचा आढावा आम्ही घेण्याचा प्रयत्न करणार आहे. बरेचदा आपल्या जननेंद्रियांकडेच आपण काहीतरी वाईट किंवा शी-घाण अशा पद्धतीने बघायला लहानपणापासून शिकवलं जात असतं आणि आता डॉक्टर प्रसन्नाच्या व्याख्यानामध्ये सुद्धा त्याची झलक आपल्याला बघायला मिळाली. बऱ्याचदा मी शाळांमध्ये भाषणं ठोकायला जातो आणि त्यावेळेला तिथल्या मुली म्हणतात की आम्हाला प्रॉब्लेम आला गेला. म्हणजे पाळी या शब्दालाच मुळी प्रॉब्लेम हा प्रतिशब्द वापरलेला असतो. त्यामुळे पाळीला प्रॉब्लेम म्हणणाऱ्या आणि एक अपवित्र मानणाऱ्या समाजामध्ये आपण राहतो. त्यामुळे अनेक गोष्टी या पाळीच्या संदर्भामध्ये या अपवित्र समजल्या जातात आणि याचा मोठा परिणाम या स्त्रियांच्या लैंगिक भावभावनांवर आणि त्यांच्या लैंगिक क्रियांवरती होत असतो, हे नकारात्मकता मनामध्ये असल्यामुळे. आता डॉक्टर प्रसन्नांनी सांगितलं त्यावरती मी असं जाऊन सांगेन की सगळ्यात मोठा लैंगिक अवयव आपल्या शरीराचा कुठला असेल तर ती म्हणजे आपली त्वचा. हा सगळ्यात मोठा लैंगिक अवयव. लैंगिक अवयव म्हटल्यानंतर लोक मोठी मोठी यादी देऊ शकतील कदाचित, पण त्वचा हा एक सगळ्यात महत्वाचा आणि मोठा लैंगिक अवयव आहे हे मात्र विसरलं जातं. आणि हा मुद्दा आपण आपल्या रुग्णांपाशी, आता खरं तर रुग्ण म्हणणं चुकीचं आहे, कारण बरेचदा या लोकांना फक्त उत्सुकता असते, जिज्ञासा असते, चुकीची समजूत असते, कुठलाही विशिष्ट आजार नसतो. पण सध्याच्या सोयीसाठी म्हणून आपण रुग्ण हा शब्द वापरूया. तर या रुग्णांपर्यंत हा संदेश पोहोचणं हे खूप खूप महत्वाचं आहे. आणखी एक महत्वाची गोष्ट आपण आपल्यापर्यंत येणाऱ्या स्त्रियांना सांगितली पाहिजे की लैंगिकता आणि आनंद हा 2 मांड्यांच्या मधल्या अवयवांवर अवलंबून नाही, तर हा 2 कानांच्या मधल्या अवयवांवर अवलंबून आहे. म्हणजे तुमचा दृष्टिकोन कसा आहे, तुमचे विचार कसे आहेत, तुम्ही स्वतःच्या लैंगिकतेकडे आणि जोडीदाराच्या लैंगिकतेकडे आणि शरीराकडे किती निरामय दृष्टीने पाहता याच्यावरती तुमचा आनंद अवलंबून आहे. हे त्यांच्या मनावरती आणि खरं तर तरुण मुला मुलींच्या मनावरती हे आपण प्रकर्षाने ठसवलं पाहिजे. आता कुठलाही आजार म्हटलं की त्याचं काहीतरी एक वर्गवारी आली, काहीतरी एक वर्गीकरण आलं. त्याप्रमाणे स्त्रियांच्या लैंगिक आजारांची सुद्धा अनेक वर्गीकरण उपलब्ध आहेत आणि अनेक नवी नवी येतच सुद्धा आहेत. पण मला कल्पना आहे की हे इंडियन मेडिकल असोसिएशननी हा घेतलेला कार्यक्रम आहे आणि त्यामुळे यामध्ये फक्त स्त्री आरोग्य तज्ञच नाहीत तर इतरही विविध क्षेत्रातली मंडळी आहेत. त्यामुळे एक साधं सोपं सगळ्यांना समजेल अशा पद्धतीचं वर्गीकरण मी इथे सादर करतोय. पहिली गोष्ट आहे की अनिच्छा किंवा कामनिरासता. त्यामुळे त्या स्त्रीला या सगळ्या प्रकारामध्ये काही रसच वाटत. दुसरा प्रश्न असा असतो की कामोत्तेजना होत नाही. तिसरा प्रश्न असा असतो की कामेच्छा होते, कामोत्तेजना पण होते, पण कामतृप्ती होत नाही, म्हणजे ऑर्गॅझम, कामतृप्ती होत नाही. चौथा प्रकार असतो की संभोगशूल, म्हणजे शरीर संबंधाच्या वेळेला वेदना होतात, इतक्या वेदना होतात की संबंध करणं अशक्य होऊन जातं. आणि पाचवा प्रकार आहे वजायनिस्मस. आता तुम्ही म्हणाल की 4 मराठी प्रतिशब्द सांगितल्यावरती पाचवा वजायनिस्मस कुठून आला? तर त्याचं कारण असं आहे की वजायनिस्मसला मला एक नाही 2 मराठी प्रतिशब्द सुचलेले आहेत. एक आहे यौन मौन, म्हणजे काही केल्या योनी तोंडच उघडत नाही, आळीमिळी गुपचिळी घालून बसते. आणि दुसरा आहे यौन खीळ, म्हणजे दातखीळ बसते ना तशी यौन खीळ. पण मला असं वाटतं की दोन्हीपैकी यौन खीळ हा शब्द जास्त समर्पक आहे आणि इथून पुढे मी तोच वापरणार आहे. याचं कारण असं की मौन हे स्वतः धरलेलं असतं. ती एक आपली ऐच्छिक कृती असते की मी नाही बोलणार जा वगैरे. पण खीळ जी असते ती एक प्रतिक्षिप्त क्रिया असते, एक रिफ्लेक्स ऍक्शन असते. त्यामुळे यौन खीळ हा शब्द अधिक समर्पक आहे. त्यामुळे वजायनिस्मसला यौन खीळ हा शब्द मी इथून पुढे वापरेन. कुठल्याही प्रकारचे ज्या वेळेला समस्या आपल्या पुढे येते, कुठलीही वैद्यकीय समस्या आपल्या पुढे येते, त्यावेळेला काही प्रश्न विचारून आपण त्या समस्येबद्दल अधिक माहिती ही जाणून घेत असतो. त्यामुळे ज्या वेळेला अशा पद्धतीच्या लैंगिक समस्या घेऊन स्त्रिया आपल्याकडे येतात, त्यावेळेला देखील ही जी काय समस्या आहे, ही वरच्या 5 पैकी जी काय असेल ती सुरुवातीपासून आहे का आता नव्याने उत्पन्न झालेली आहे, ती विशिष्ट परिस्थितीमध्ये उद्भवणारी आहे का कधी सार्वत्रिक अनुभव असा तो आहे, त्याच्यामुळे त्रास कितपत होतोय, म्हणजे सौम्य त्रास आहे का मध्यम त्रास आहे का तीव्र स्वरूपाचा त्रास याच्यामध्ये उद्भवलेला आहे, जोडीदाराला काय त्रास होतोय याची देखील आपण चाचणी केली पाहिजे. आणि पार्श्वभूमीमध्ये इतर काही आजार आहेत का, मधुमेह असेल, कुठली गोळ्या औषधं चालू असतील, नैराश्य असेल, असे काही आजार आहेत का याची माहिती ही आपण घेतली पाहिजे. त्याच्यानंतरच आपल्याला याबद्दल काही विशेष मदत त्या स्त्रीला करता येईल. ही जी सगळी माहिती विचारणं आणि ती माहिती घेणं, हे घेतली पाहिजे, विचारलं पाहिजे असं म्हणणं खूप सोपं आहे, पण प्रत्यक्षात अशा पद्धतीने माहिती घेणं हे खूप कौशल्याचं आहे आणि ते कौशल्य कमवावं लागतं. सगळा इतिहास तुम्ही त्याला विचारणार, पण त्याच्यानंतर नेमके कुठले शब्द वापरायचे, कुठल्या शब्दात आपली अडचण सांगायची, बद्दल उभय पक्षी गोंधळ असतो. म्हणजे त्या स्त्रीच्या मनातही असतो आणि डॉक्टरांच्या मनात सुद्धा असतो. दुसरी गोष्ट म्हणजे उभय पक्षी संकोच असतो, टेबलाच्या दोन्ही बाजूला संकोच असतो. याच्यावरती सगळ्यात साधा सोपा उपाय म्हणजे त्या स्त्रीला आणि तिच्या जोडीदाराला सहसा मंडळींनी बरोबर यावं अशी अपेक्षा आहे, तर काही पुस्तकं तुम्ही वाचायला देऊ शकता. डॉक्टर विठ्ठल प्रभूंचं निरामय कामजीवन हे पुस्तक मी सर्रास वापरतो आणि अर्थात तुम्ही जे कुठलं पुस्तक निवडाल अशी अनेक पुस्तकं मराठीत उपलब्ध आहेत. उत्तम डॉक्टरनी लिहिलेली अनेक उत्तमोत्तम पुस्तक आहेत, पण ते पुस्तक तुम्ही स्वतः वाचा. त्यातल्या संकल्पनेबद्दल, भाषेबद्दल तुम्ही निशंक आहात ना ही आधी खात्री करून घ्या आणि मगच अशा पद्धतीची पुस्तकं त्या स्त्रीला वाचायला द्या. हे 2 गोष्टी होतात. एक म्हणजे जवळजवळ 80% गोष्टी या चुकीच्या समजामुळे, चुकीच्या माहितीमुळे प्रश्न निर्माण झालेले असतात, ते आपोआप सुटतात. दुसरं म्हणजे आपले प्रश्न कुठल्या भाषेत मांडायचे याबद्दलची नेमकी जाण आणि जाणीव त्या जोडप्याच्या किंवा त्या स्त्रीच्या मनामध्ये निर्माण होते आणि डॉक्टरांशी बोलताना अधिक मोकळेपणा येतो. तिसरी गोष्ट म्हणजे बोली भाषेमध्ये आणि लिखित भाषेमध्ये प्रत्येक शब्दाच्या अर्थाच्या वेगवेगळ्या छटा असतात. आज मराठी भाषा दिवस आहे, त्यामुळे याबद्दल आपण विशेष सजग राहायला पाहिजे. संबंध येणं असं तुम्ही म्हणता, तुमच्या मनामध्ये त्याचा अर्थ कदाचित कॉन्ज्युगल सेक्स म्हणजे प्रत्यक्ष लिंगाचा योनी मार्गामध्ये प्रवेश असा असू शकेल, पण कदाचित त्या स्त्रीच्या मनामध्ये त्याचा वेगळाच काहीतरी अर्थ असू शकेल. त्यामुळे जे तुम्ही बोलताय आणि ज्या उद्देशाने बोलताय तोच अर्थ तिच्यापर्यंत पोहोचतोय ना, हे अशा पद्धतीची पुस्तकं दिल्यामुळे एक शब्दसंग्रह तयार झाल्यामुळे हे काम खूप सोपं होतं. तुम्ही स्वतः काही चित्रफिती बनवू शकता आणि त्या चित्रफिती देखील त्या स्त्रीने पाहाव्यात असा आग्रह धरू शकता. मी स्वतः युट्यूब चॅनलवरती अशा काही चित्रफिती निर्माण करून टाकलेल्या आहेत आणि बरेचदा असे काही रुग्ण आले तर त्यांना या चित्रफिती बघायला सांगतो आणि मगच माझ्याकडे या असं सांगतो, त्यामुळे माझा वेळ वाचतो. मग अर्थातच अशा स्त्रीची शारीरिक तपासणी, आवश्यक त्या रक्तलघवीच्या वगैरे तपासण्या केल्यानंतर या 5 पैकी कुठल्या तरी एका निदानापर्यंत आपण अगदी सहजपणे पोहोचू शकतो. कामनिरस्तेपासून सुरुवात करूया. याचं कारण असं की नुकतंच फिमेल व्हायग्रा या नावाने बराच गाजावाजा होऊन फ्लिबेन्सरिन नावाचं औषध आधी अमेरिकेत आणि आता भारतात सुद्धा उपलब्ध आहे. फिमेल व्हायग्रा या नावाने या बाजारामध्ये, म्हणजे सामान्य भाषेमध्ये त्याला फिमेल व्हायग्रा असं म्हणतात, त्याचं शास्त्रीय नाव फ्लिबेन्सरिन. म्हणजे असं आहे की चांगलं देवा ब्राह्मणांच्या साक्षींनी लग्न बिग्न झालंय, पण आता तिला ह्यात काही रस उरला नाही. अशा पद्धतीची समस्या असेल तर हा निष्काम कर्मयोग हा या क्षेत्रामध्ये फारच त्रासदायक ठरतो. म्हणजे नवऱ्याला जवळ येऊ द्यावं तर त्या स्त्रीला ते आवडत नाही, लांब राहावं तर त्या नवऱ्याला ते पसंत नसतं, डॉक्टरांच्याकडे जावं तर डॉक्टर सुद्धा याच्यावरती फारसं बोलायला उत्सुक नसतात आणि मग याच्यातनं ताणतणाव, भांडणं आणि इतर अनेक समस्या या निर्माण होतात. खरं तर स्त्रियांची कामेच्छा वाढवणारा एक प्रसिद्ध पुरुषरस आपल्या सगळ्यांना माहित आहे आणि तो म्हणजे टेस्टोस्टेरॉन. हा टेस्टोस्टेरॉन हा तर पुरुषस्त्राव आहे आणि हा पुरुषस्त्राव स्त्रियांना जर का दिला तर त्यांची कामेच्छा वाढते असं ही माहिती आहे आपल्याला. पण याला वापरायला मर्यादा आहेत. पहिली गोष्ट अशी की हा पाळी गेलेल्या स्त्रियांच्या मध्ये वापरता येतो. तो वापरणं हे फारसं सुरक्षित नाही, त्याचे इतर सहपरिणाम असतात, ते हवेसे नाहीत. त्यामुळे या कारणाने हा काही फारसा लोकप्रिय असं औषध नाही. त्यामुळे या फ्लिबेन्सरिनचं आता कौतुक आहे. हे फ्लिबेन्सरिन कुठल्याही वयामध्ये देत आहे, फक्त वयस्कर स्त्रियांमध्ये देता येणाऱ्या टेस्टोस्टेरॉन पेक्षा हे कितीतरी अधिक चांगलं. मुळातच अशा हरिहरी करायच्या वयामध्ये हरीचं मन राखणाऱ्या बायका अशा किती, त्याच्यामध्ये त्यांच्या किती जणांना हे लागणार, असं काहीतरी प्रश्न आपल्या पुढे येतात. कशा पद्धतीने हे फ्लिबेन्सरिन काम करतं? डोपामिन आणि नॉरएपिनेफ्रिन यांचं प्रमाण ते मेंदूमध्ये वाढवतं. म्हणजे एका पेशीकडून दुसऱ्या पेशीपर्यंत संदेशवहन करणारे जे मार्ग आहेत त्यातलं डोपामिन आणि नॉरएपिनेफ्रिन हे त्याच्यामुळे वाढतं आणि सेरोटोनिन हे कमी होतं आणि परिणाम स्वरूप कामेच्छा वाढते असं याचं कार्य सांगितलं जातं. पण ना हे परिणाम दिसायला असेल तर ते जवळजवळ महिनाभर आधी वापरावं लागतं आणि शिवाय इतकं करून त्याचा परिणाम दिसतीलच असं नाही. त्यामुळे भाग्याची अंगठी जशी कुणाला लाभते कुणाला नाही, तसं फ्लिबेन्सरिनचं आहे असं म्हणायला हरकत नाही.
Sorry sir, can I interrupt you for 2 minutes?
Yes.
There are so many audience who are non-Marathi and they are not understanding. So there is request coming from people.
Okay. So you want me to switch to English?
Yeah, because for the audience itself. There are so many messages which have come in chat box. That's why.
Sir, mixed
Possible.
language will do.
Sorry?
Mixed language will do, Marathi and English.
Okay, fine.
Fine. I'll start with the mixed language. Anyway.
Yeah.
मुळात बायका हीच एक डोकेदुखी असं सार्वत्रिक मत आहे. And women, they are considered a headache anyway, but then studying women is even more of a headache, and studying women for their sexuality is even more of a headache. But then, of course, you are all aware that the pioneering work was done by Masters and Johnsons in America, and they described what is called as the sexual cycle. They described the excitement phase, the arousal phase, the excitement phase, the plateau phase, orgasm, and resolution. Graphically, we can show these phases like this. So, and compare the male and the female sexual cycle. So there is an excitement phase in the male, then there is a plateau, and then just before there's a pre-orgasmic increase in the excitement, and then there is the orgasm. And following this, there is what's called as a refractory period. So for a certain amount of time, the male will not be as excited as before and will not be able to enjoy sex or ejaculate. That is called the refractory period. Now, this varies according to the age and so many other factors, but this is a fact. As compared to that, the women, they reach excitement, and you will see there are several graphs because the women, they show several types of sexual response cycles. So there is an excitement, then there is a plateau, and then there are multiple orgasms which are possible in case of a woman, which is not possible in case of a man. Or there can be a quick rise in excitement, a plateau, but this woman doesn't reach orgasm at all. This is also possible. And in fact, it is said that several women will not experience orgasm throughout their life and will never know perhaps what orgasm is like. Of course, since they don't know what orgasm is like, they will come and complain to you only if somebody tells them that, oh, this is how it should happen. And if you have not experienced it, there is some problem. And then there is this third type wherein the woman reaches a quick orgasm and then falls back to the normal and achieves resolution. But just as the male orgasm ends and brings up resolution of the sexual stimulation, in case of women, that happens not just with orgasm, but with post-coital intimacy. That was what Prasanna also referred to some time ago. So this is post-coital intimacy, body-to-body contact, very personalized, sweet nothing talks. These are the ones that are more, that bring about resolution and enhance the orgasmic effect in case of a woman, and they're extremely important. This particular aspect is often neglected or remains unknown to the couple for a long period of time and leads to marital conflict quite often. Of course, this is not just the end of the story. And the sexual cycle that I talked about has been modified by so many other researchers, especially Dr. Basoon and so many others. And they have added a few other phases to this particular cycle. But let us not go into those details. What is the tablet going to do? The tablet is going to give you an enhanced libido. It is going to give you an enhanced desire to have sex. But if you don't have the first two phases and only the excitatory and the other phase, and it is directly going to increase the sexual urge, people believe that it may not be as enjoyable. It is like seeing the third act of a play without enjoying the first and the second, and the third may not be as enjoyable then. Basically, we must understand the brains of women and men are designed differently. Though this is a cartoon which shows that there are two big sex centers in the man and which are replaced by a shoe center and a headache generator in case of a woman, the fact of the matter is that the Masters and Johnson textbook, it has got a very nice cartoon. You know, there are two people, a man and a woman in bed, and the man is holding a placard. They've just had a fight, and the man says, "No sex, no love." Women is also holding a placard in her hand, and she says, the placard reads, "No love, no sex." So these are the priorities which are totally opposite to each other between men and women. So therefore, it is important to study this topic, but at the same time, it is extremely difficult because how are you going to define what is normal? We have those criteria to diagnose, say, mitral stenosis and things like that. But then as far as sex and sexuality is concerned, it is very difficult to define normal sexual activity. Like so many embraces in so many minutes, so many kisses in so many minutes, so many touches and in so many minutes. These cannot be the definitions. And then what are you going to do about all these different types of sex? Do you just include penovaginal intercourse? And then how about anal intercourse? How about oral intercourse? How about homosexual intercourse? What are you going to do about all these things? Are you going to prescribe these tablets when, say, a lesbian woman comes and says that she needs to increase her libido? So these are the questions that the flibanserin invention, I mean the flibanserin tablet has thrown up. Also, biology tells us that as humans, as Homo sapiens, we are actually polygamous, men and women. So to continue with a single partner lifelong is actually not a very biologically, scientifically correct thing to expect. That is the social norm, but still. म्हणजे व्रतवैकल्य हा शब्द तुम्हाला माहित आहे. व्रत म्हणजे काय तुम्हाला माहित आहे की एखादी गोष्ट ठराविकपणे करणे, पण वैकल्य म्हणजे स्वतःला त्रास करून घेणे. म्हणजे एका जोडीदाराशी एकनिष्ठ राहणं हे समाजाने स्वतःवर लादलेलं वैकल्य आहे असं म्हणायला हरकत नाही. त्यामुळे नभा चंद्रमा जरी तोच असला, यामिनी जरी चैत्रातली असली आणि कामिनी जरी तीच असली, तरी तीन आर्तता उरात स्वप्नतेन लोचनी असा अनुभव हा सार्वत्रिक आहे असं म्हणायला हरकत नाही. कारण अनेक आहेत की अशा पद्धतीने का हे होतं ते. पहिली गोष्ट म्हणजे जीवशास्त्रीय कारण, वैद्यकीय कारण, like chronic pain, illnesses, diseases, recuperating from something, the aches and pains. Menopause will give rise to endocrinal changes which may not make the entire sexual episode all that happy, because there is dryness in the vagina, or there are mood swings, or there is incontinence, and so many other problems. There can be relationship issues and the couple may be fighting. There may be drugs which lead to depression and such other problems. There are taboos. Certain religions and certain sects and certain orders, they allow or don't allow certain types of union, certain types of sexual practices. And these may give rise to a lot of anxiety. And a damaged self-image is also a very, very important factor. त्यामुळे त्याची तयारी आहे आणि हिची तयारी नाहीये, किंवा हिची तयारी आहे आणि त्याची तयारी नाहीये, असं होऊ शकतं. आणि मग अशा परिस्थितीमध्ये मदनबाण हा चुकणारच किंवा रतिकटाक्ष हुकणारच. त्यामुळे दोघांचीही तयारी नसेल तर मग मदनरंगी ती रती रंगणार नाही आणि मदन कधी रतिक्लांत होणार नाही. शंकरांनी आपला तिसरा डोळा उघडून कामदेवाला भस्म करून टाकलं, पण आपण काही शंकर नाही. सो वी कॅनॉट ऍक्च्युअली ओपन दी थर्ड आय अँड destroy and burn to ashes these problems which are arising from karma. So what we have to do is we have to study, define, and actually come to a reasonable conclusion as to be what is to be done. So this hypoactive sexual interest to desire disorders, they are defined as absent or diminished feelings of sexual interest, thoughts, and fantasies, and motivation to become sexually aroused are scarce or absent, and beyond the normal lessening of age and age of relationship. So it is beyond normal. So some amount of loss of interest and loss of desire is normal. That is what this definition tells us. Also, there is a very important clause, not in just this, but all the other definitions in sexual medicine, that this should be causing distress to either of the partners. So if it does not cause distress to any of the partners, if she doesn't matter, if she doesn't bother and he doesn't bother, then it is none of our bother to treat such conditions. A lot of studies after this particular definition came up, a lot of studies have come up, and the incidence of lack of sexual desire is pegged at somewhere around 43%. Now, the question that begs the answer is that if this is as common as 43%, do we label this as normal or abnormal? What exactly do we label this as? And this is the question that Ray Moynihan, a famous journalist from Australia, he put forth in his book Sex Lies, and also in his paper in the British Medical Journal. He said that doctors and the pharmaceutical industry have not discovered a new drug. They have actually coined a new disorder. They have discovered, or they have invented a new disorder to sell a drug. That was his argument. But of course, there were people who countered this particular argument, because he said that this is medicalization or marketization of a very, very normal and natural happening. The counter argument was that, well, diseases are also discovered, invented, defined, and studied over the last few decades. Think of alcoholism. Addiction was never thought to be a disorder which could be treated, or depression, or osteoarthritis, age-related osteoarthritis. Now, all these three disorders are sort of invented afresh, but there are plenty of people who have benefited from the modern management of these particular disorders and continue to be benefited from them. So it is okay to invent a new disorder, and Mr. Moynihan need not get worked up about it. It is quite normal to study such disorders and to come to a reasonable conclusion and try and help the patients. Coming to the next, the anatomy of a female has been extensively studied, but then we are looking at this particular anatomical aspects from the sexual medicine point of view. Now, the most important can you hear me? The breasts are perhaps, the most celebrated symbol of female sexuality. And it is a myth that larger the breast, the better it is, more sexually arousable is the woman. The size of the breast has nothing to do with it. Also, a lot of women, they are worried about their size of the breast, and they keep on using creams, lotions, massages, and so many different pathies to increase the size of the breast. We must tell them that nothing apart from mammoplasty is going to help them. Yeah. Coming to the sexual anatomy, we've all studied these organs. The vulva, the mons veneris, the labia majora, the labia minora. But the clitoris happens to be the most important sexual organ, which is the anatomical congruent organ of the penis. It has got a hood, gland, shaft, and crura. Clitoral circumcision is being practiced in certain clinics because it is said that if just like the smegma collects below the hood of the glands of the penis, so also some type of secretions they collect in the clitoral area also, and they can be cleaned, and a clean clitoral area, it helps in sexual pleasure. So removal of smegma is said to help. Then there are Bartholin glands, but all these glands and the cervical secretions, they play very little role in lubricating the female genital tract during sexual activity. What lubricates the genital tract is what is termed as vaginal sweating. So the increased blood flow and the sexual arousal that happens because of this leads to wetting of the vagina, and this does not come from any particular gland as such. So that is why even after a hysterectomy, the woman can have good lubrication and can continue to enjoy sex. I think hymen has been talked about a lot. Hymenoplasty is just a plastic surgery of the hymen for those bent on recreating the hymen. I'll not dwell on it further than this. The vagina, one must understand, is sensitive only in the outer few centimeters to touch and other sensations. And therefore, the size of the penis is not much of a problem as far as vagina is concerned. There's a lot of talk about G-spot, that is one particular neurovascular anterior vaginal wall. And this was called the G-spot. Now it is said that why just a spot? The whole of the anterior vaginal wall is like an orgasmic highway, and it is highly sensitive to and rich in nerves and vessels. And of course, I have already dealt about the role of cervical mucus. Coming back to these anatomical things, what we must need to understand is that there are different ways of looking at the same anatomy. Like, for example, the feminists have come up with their own version of anatomy. They believe that the anatomy as described in the anatomy textbooks is incorrect. The clitoris is not given all the due importance. And this is the picture of clitoris that they would want us to imagine. So clitoris is a huge organ which is much larger than the vagina. It has got the corpus cavernosum, the crux of the clitoris. It has got the clitoral glands and such other paraphernalia, and it is the clitoris that is more important. This picture also shows you the same thing, a bigger clitoris than we usually imagine it to be, and a smaller vagina. This, according to the feminist, is a reasonable depiction of the female genital anatomy. So a man is always obsessed with coital sex, whereas in case of a woman, the coital sex is not very important. Like I told you while discussing the anatomy of the vagina, it is just the outer 1/3 of the vagina that is sensitive, and therefore the size of the penis does not hold much importance in human sexual encounters. Like, does not hold as much importance as a young boy or a man is obsessed with. The market, the internet is full of, drugs and devices to increase the size of the penis. Coming back to the orgasmic aspect, I told you that it is the intimacy, post-coital intimacy that matters. Now, the whole development in this particular field received a big stimulus following the advent of Viagra. Now, let me tell you that exactly a month from now, Viagra will be completing 24 years and will be entering in the 25th year. So we'll say happy birthday, Viagra. And Viagra actually brought to the fore all the important aspects of sex and sexuality. The Pfizer company, it studied Viagra, imagining that it should be helpful in women as well. But to their great dismay, after 8 years, they found that it isn't as useful. And if at all a drug has to be working on women's sexuality, it should be working on the brain and not on the genitals. And that is why flibanserin, which was studied particularly for its antidepressant action, was thought of as an eligible candidate and studied further. But a lot of politics went into getting approval from the FDA. An International Society for Study of Women's Sexual Health was formed. This was funded by the pharma companies. The women's group, they formed Our Bodies, Ourselves. The women's group also, and then the opposing group also formed Even the Score. A lot of petitions were made to the FDA. The members of parliament, they chipped in. The patients, they chipped in. And finally, the Even the Score group, they said that this is actually nothing but a male chauvinistic attitude towards a drug that will be so helpful to women. You are delaying the approval because this is a drug that is useful to women. Had this been a drug useful to men, then things would have been different. That was the argument. So after a lot of argument, a public hearing was held by the FDA, and finally the drug got approval. And the company that manufactures the drug, the shares of the company increased by 46% the very next day. Anyway, so medicine is not just medicine. It has got economics. It has got so many isms involved in it. And of course, we should be aware of all these trends and turbulences that are all around us. Coming back to our topic, we were talking about persistent lack of sexual desire. And in our course of discussion about flibanserin, I have given a details about the sexual anatomy, the sexual physiology, and certain aspects of sexual pathology also. Coming to persistent inability to become aroused and the lack of orgasm despite arousal, for want of time, I believe that you can visit some sites on the internet and search for yourself. There are protocols and stepwise programs as to how to communicate and how to teach a woman to reach orgasm on her own by masturbating, so that she knows what orgasm is and she can employ these techniques and similar other techniques during the act of intercourse so as to bring herself to orgasm. But of course, you need the partner to be very cooperative and understanding if at all this has to happen. Coming to dyspareunia. Now, there is a long list of causes of dyspareunia, but in a nutshell, I can tell you, because I understand that there are non-gynects here. In a nutshell, I can tell you that any pathology of the pelvic organ, may it be adhesions, infections, inflammations, malignancies, can give rise to dyspareunia, of course. And that is why you first have to hunt for all these anatomies before you label it as intractable. But despite a thorough search, what remains a very, very touchy question is what is called as vulvar vestibular syndrome or vulvodynia. Now, this is a condition wherein you find no apparent cause, no viral infection, no bacterial infection, no fungal infection, nothing at all, but the patient keeps complaining of tender area over the vulvovaginal area. And the tenderness may not be just limited to the act of sex, it can be all pervading all the time, and can make life very, very difficult for these women. It is very difficult to treat this condition. And this vulvodynia has been classified. What you are seeing in the clip, the video clip, is a plastic surgery of sorts, for this, what is termed as Vulvo Vestibuloplasty. So as a last resort, what is done is that the tender area of the mucocutaneous junction is dissected away and a flap of skin is placed there to create a new mucocutaneous junction. This helps most of the times, and as you view the clip, because I don't think the technical details are required now, I will go over the etiology. Now, like I told you, in 1999, a new classification of vulvovaginitis was released, and it classifies this condition as generalized vulvar dysesthesia, localized vulvar dysesthesia, vestibulodynia, clitorodynia, and others. But of course, despite the classification, no great advance was made in the management of this particular disorder, because we still do not understand the etiology well. And these patients also have associated disorders such as lack of arousal, or lack of desire, or lack of orgasm, and even vaginismus. We'll come to the vaginismus a little while later. And almost every type of drug in the pharmacopoeia has been tried for this condition. People have given estrogen, people have given progesterone, people have given testosterone, people have given steroids, people have given antivirals, antibiotics, even anticonvulsants. So all these things have been tried. People have given local alcohol injections, tied jellies with xylocaine, and such other things. And finally, we have this vulvo vestibuloplasty, which helps, like from whatever little experience I have, in extreme cases, this does help. One more thing that is usually missed is Keggles exercises. Now, Keggles exercises somehow teach this patient to relax that particular area. So if the pain is related to this muscular contraction, tight muscular contraction, that actually sometimes helps, because the patients are taught to contract and relax the area at will. We'll go over to the next slide. Just a moment. Yeah, coming to vaginismus. Now, again, what you are seeing in the video clip is what is termed as a Z-plasty of the bulbospongiosus muscle. Now, bulbospongiosus is a superficial muscle. It is a very thin muscle, and you do a Z-plasty, like cut it in such a fashion and re-suture it so that it lengthens, so that the reflex contraction of this muscle will not be as effective as before. Now, the point is that it is not the bulbospongiosus that causes vaginismus most of the times. It is the pubococcygeus muscle that is more involved. And then you can't do any Z-plasty on the pubococcygeus muscle. But I came across this particular modality of therapy, and so I thought that I should include it in this presentation. And also put a rider that though I have done this a couple of times, I really do not, and the patients have been helped, I really do not understand how it actually helps. Probably it is the placebo effect of this surgery and not the surgery itself that helps. But of course, this Z-plasty and things are very rare and perhaps the last resort. What should be done is a good explanation of the anatomy. So have a mirror, or nowadays there are selfie cameras with the patient also. So the patient holds the camera in such a fashion that she is able to take a good look at her own genitalia, while the doctor explains the anatomy properly, first to the patient, then allowing the husband insight to the husband also. Then she is taught the techniques of muscle relaxation, the Keggles exercises. Now, mind you that this is not a quick fix solution, and the patients really have to practice these exercises and get hang of what exactly is to be done. Then come the serial dilatation. Such vaginal dilators are available, and the serial dilatation is advised. If you don't have the dilators, you can always begin with the cervical dilators, which can be put to good use. And first of all, the patient is asked to dilate her own vagina. Patients are usually surprised to see that such big dilators, wide dilators, can actually enter her own vagina. And the fear, which is the prime factor, it lessens over a period of time. Once the patient is able to do it, then allowing the husband to do it in presence of the staff nurse or any health worker is next. Then the patient, all this time, the couple is advised not to attempt intercourse because they are likely to, misdo things. Later on, the woman is asked to dilate her own vagina at home, walk with the dilator in situ for some time, be comfortable with that particular dilatation of the introitus, following which the husband is asked to dilate the vagina just prior to coitus and then attempt a coitus. So it is not a quick fix solution. It takes time and it is a stepwise thing, and you must tell the couple to understand all the steps properly before they actually do this. Also, one has to be very frank, open, and forthright, draw a line diagram and explain to the couple that it is better that they adopt the female on top position, the horse riding posture, rather than the missionary position, the classical position for sex. This allows the woman, gives some control to the woman as to how much penis enters the vagina. That is the benefit of this particular position. So, all said and done, we are in a very delicate situation, and after a detailed explanation, patients are helped, and they usually have they consume their marriages very, very soon. Dharma, Artha, Kama, and Moksha. These are the 4 Purusharthas. हे 4 पुरुषार्थ सांगितलेले आहेत. पण पुरुषार्थाच्या बरोबरीने समकक्ष असा स्त्रियार्थ असा शब्दच आपल्या भाषेमध्ये नाही. त्यामुळे धर्म, अर्थ, काम आणि मोक्ष याची जबाबदारी गरीब बिचाऱ्या पुरुषांवर येऊन पडलेली आहे. त्यामुळे ही जबाबदारी पार पाडता पाडता पुरुष बिचारे पार मेटाकुटीला येतात. पण या धर्म, अर्थ, काम, मोक्ष या 4 पुरुषार्थ हे फक्त पुरुषांसाठीच असल्यामुळेचे परिणाम आणि दुष्परिणाम आपल्याला या सगळ्या लैंगिकतेच्या प्रश्नांमध्ये दिसत असतात. आज नाशिक आयएमएने मला इथे बोलावलं, याबद्दल माझा मित्र डॉक्टर निलेश आणि इतर सर्व संयोजकांचे मी मनपूर्वक आभार मानतो. आणि तुम्हाला आणि तुमच्या रुग्णांना निरामय कामजीवनाच्या शुभेच्छा देतो आणि इथेच थांबतो. धन्यवाद.